I'm Gordon Skilling and I'm a forensic psychiatrist at the State Hospital. I've been privileged to be part of the fantastic team here for a number of years, but I can definitely say that there's still a lot of misunderstanding out there about what the State Hospital is and what it does. So firstly, the State Hospital is exactly that. It's a hospital. It's not a prison or a place for punishment, and it's certainly not a scary place to work in or to be in. In fact, it feels very calm and safe. The hospital is part of our National Health Service in Scotland, and it's a small part of a wider network of secure mental health hospitals that care for patients across the country. It's very much a therapeutic place of care and treatment for patients, and a place of everyday work for our incredibly dedicated staff. We're a team of people who work together to do the best we can for the people who are here. And I feel very fortunate to be part of that. Now, of course, because of the particular needs of the people who use our service, there are some unique features of our hospital, such as our levels of security. Fundamentally, these are there to keep everybody safe, and that includes our patients and visitors, as well as all of our staff. Safety is one of our top concerns. But so too is the delivery of excellent state-of-the-art healthcare. And sometimes it can feel like the focus on keeping everybody safe can stifle change and innovation. And in healthcare, especially in a public health service like our NHS, we always need to be evolving and improving as the scientific evidence grows and best practice develops. And that's as much true here as it is in your local GP practice or in an operating theatre, for example. One of the most rewarding parts of my job is working together with our staff and patients to develop and test their ideas for positive change, always with the aim of continuing to improve the quality and safety of our service. I'm really fortunate to work with such a group of enthusiastic and creative staff who care passionately about their patients, their colleagues, and the service that they provide. The extent to which our staff have embraced opportunities to innovate and improve recently, and to really put patients at the centre of everything that we do, has been incredible. And we've been lucky enough to receive some really positive recognition for the hospital, including at a national level for all these efforts, and that's been great. But the biggest reward, I think, has been to see so many of our staff so engaged and motivated and enjoying their work. And that in itself is a really powerful force for improving patient care. Now, COVID-19 has meant that we've all had to make massive changes to the way that we live and work. And it's been a very unsettling and stressful time, particularly for our patients and their loved ones. But if anything good has come of it, then it's been the realisation that the State Hospital, along with the wider NHS, can adapt, can change and can innovate, and can do that at pace and also in a safe way. Now, I think the improvement journey that we'd already started here at the State Hospital before the pandemic really helped us to pull together to respond with confidence and respond effectively to the crisis. And I think it will be crucial to how we move forward as we get over the pandemic. We're really lucky here to have such a modern, purpose-built, state-of-the-art facility that's well resourced. But for any of that to work, we really need to make sure that we look after our staff, who are, after all, our most precious resource. The work here is challenging, but it's also really rewarding. It can be stressful at times, so we need to make sure that our staff feel supported, that they feel that clarity of purpose, and that they feel that they have influence in the jobs that they do. And it's the same for our patients. They need to be at the centre of all of our efforts to improve and to have their voices heard at every stage of their journey. It's definitely been an exciting and rewarding journey at the State Hospital over the past few years, but we've really only just begun, and there's still loads to do. There's not a day goes by when I come to work and I don't feel amazed at the incredible things our staff group do with compassion, with patience, with commitment, day in, day out, in what can often be quite challenging circumstances. The people who work here are highly motivated to care for some of the most complex and high-risk patients that we have in our health service in Scotland. So any progress that we make and any recognition that we receive is really testament to them, to their efforts, their enthusiasm, their professionalism, and their commitment to the patients and also to each other. It's an exciting time to work here at the State Hospital, and I'm really confident that together we will keep progressing, we'll continue to provide excellent care and also be a valued part of our Scottish NHS.